I'm going to kick things off by kind of posing an icebreaker question to you guys. So in just a sentence or two, tell us what you think of when you hear the term access disparities. What does it mean for you and your work? And this question's for everyone.
Okay. Well, I've been kind of immersed in this for the last year, but to me, it just means that although families may be eligible for different benefits and supports that they need for their children, they may face different kinds of barriers in accessing them, whether it's transportation, language barriers, complicated application processes. There's all kinds of things that can get in the way of families getting the resources that they need.
Yeah, and I would just say that despite these existing programs and policies to support things like nutrition, early childhood education and care, and support adequate income, many children and families in this country still do not have a fair and just opportunity to be healthy. And we need to keep striving to achieve health equity for children and families, which is a key goal of the Robert Wood Johnson Foundation.
Two things in particular come to mind for me. I think one is how much we actually do not know about program access and the importance of really improving our data collection strategies to understand the issue better and to also therefore address it. I think the other thing is the optimistic side of me really thinks about the innovative ways that states are collaborating to really expand access to critical supports and programs while thinking about disparities along multiple dimensions, which include race and ethnicity, disability, and place, among other issues.
I'd add that at the Casey Foundation, our whole mission is improving the conditions and outcomes of disadvantaged kids and families. So when I think about disparities in access, I'm always thinking about those as principal determinants of how the kids are going to do, how their outcomes are going to be. So in our 30-year-old Kids Count program, we measure outcomes, and we see the outcomes not so good sometimes, particularly in the southern and southwestern states. So we have to think about strategies, and reducing the disparities in access has always been a key priority for us.
So I think for me, when I think about access disparities, it's really a focus on systemic barriers. What are the systemic barriers that keep individuals from being able to participate in services and supports and programs that are really intended to support their economic stability? For class, we really look at these disparities by race and ethnicity, in part because we know that systemic racism is a big reason for many of these disparities. And for us, we think a lot when we're looking at the policy level, thinking about policy, but also the funding, the implementation of those policies, how all of those pieces really contribute to those access disparities.
Well, Diane, can you kind of give us the lay of the land and talk to us a little bit about the current state of early care and education access and participation disparities in some of these programs?
Sure. Well, it's complicated because funding for early childhood education comes from a lot of different sources. There are federal programs like Head Start and Early Head Start. There are state and district pre-K programs, childcare subsidies, childcare independent tax credit, and of course, parent co-payment. So there are lots of different sources, and it's challenging to analyze the disparities because there's no one national data system for tracking participation across all of these programs. And a few states have early learning data systems that would allow us to do that. We know that low and middle income families participate less frequently in any kind of early care and education compared with higher income families. There are many reasons for the disparities. Part of the problem is that while there are public programs for low income families, there just aren't enough resources to serve all the families who need it. Where children live also makes a big difference, and I think that's a theme across all three of these areas that we're going to talk about today. There just isn't enough supply of early care and education in many communities, especially for infants and toddlers. And then there are other kind of barriers related to application and eligibility requirements for the different funding sources and programs. And families having unstable work schedules also make it difficult for them to access early care and education.
And Mike, I was wondering if you could talk about the kind of the impact of disparities on access and participation when it comes to nutrition and income support programs. Kind of what programs are we talking about here, and what challenges do low-income families face?
Sure. the big program by the way, just let me do a quick commercial. These issue briefs are really, really good. You did a great job. I highly recommend. I'm going to be sending them out tonight or tomorrow to about 3,000 people across the country, Kids Count organization. I think it's a really good resource, and I think it addresses some of these issues in very good ways. So the big programs, of course, in nutrition are WIC and SNAP, food stamps. The big programs in the big policies in income support are primarily now tax credits. TANF, I think, is really, way secondary or tertiary. So tax credits are very important. And there's wide variation across the country because there's wide variation in the states. As the issue brief points out, over half the states have EITC. Many of the southern states have very regressive tax policies that, tax enormously regressive rates. So there's a wide variation among the states. Over the last dozen years or so, we've reduced the challenges faced by families by things like streamlining eligibility, presumptive eligibility. The Affordable Care Act did a lot. The Recovery Act did a lot. States have done some very exciting things about cutting application forms down from 40 pages to 4 pages, saying that if you're eligible for SNAP, you're automatically eligible for other food programs. So we've made enormous progress, but in the last year and a half, the challenges have just exploded. All the progress we've made over a decade is threatened by what's coming out of DC now. Whether it's public charge, saying to families who are here legally with a green card or whatever, that if your child takes WIC or SNAP or TANF or early child care and education, your status can be jeopardized when it comes time to renew your green card. To me, that's cutting access off right at the work requirements. If adults lose their SNAP or Medicaid benefits, that affects the kids. So, and we're seeing it over and over again. So now, instead of making progress, we're fighting defensively against what we see coming out of Washington, and that's a big challenge. We still can do good things. I think there's a lot that can be done. We can work with states where, the momentum can continue, but I think the challenges have increased in the last several months in scary ways.
Financing, eligibility, language, geography, kind of all of the above. Walk us through that.
I would say it is all of the above. I think supply is one of the big issues. I think we've all heard the term food deserts, but there's also childcare deserts where there just aren't high quality or even licensed options for families. I think the nature of low-income work also creates a lot of challenges when families don't have a stable work schedule. They work on weekends, in the evenings, or late at night, or their schedule is constantly changing. It can be very difficult to get their child into an early childhood program that has a regular daytime schedule. So those are some of the challenges. I don't know if you'd like to talk about others.
That, and then I'll add a little bit. I think it's really important to understand the context in which we're talking about access disparities, which is really that there is woefully insufficient funding for these programs in the first place, right? So across the board, before you even begin to look at various groups, you see that very few children are receiving childcare subsidies, for example. About half of eligible preschoolers are getting Head Start services. So across the board, we have a problem with access. And then I think all of the pieces that you named, whether it's the insufficient funding, the antiquated funding formulas, changes in where populations are in states, all of this starts impacting who's getting access to these programs. At CLAS, we've looked most closely at this issue related to racial and ethnic disparities in the child care subsidy program. And I think the big story there, we again see far fewer children in Latino families having access to the child care subsidy program. And that's not about eligibility. So we've looked at actually the share of eligible kids. So when you look across eligibility, you see that these kids still aren't participating at levels equal to other groups. And huge variation by state as well. On child care subsidies in particular, we know that state policy choices play a big role in this. The federal government sets kind of the big policies, and then states make lots and lots of choices underneath there. So I think, we're learning a lot more about the actual disparities, but when I think about the agenda for research, it's really starting to unpack what those policy choices are that states are making, either intentionally or unintentionally, and how they have disparate impacts on different groups. So I think that's a big piece of the research agenda that's yet to come.
Alex, what are we seeing at the state level?
Sure. So I want to preface my comments by saying that at NGA, our goal is to really meet governors where they are in any policy conversation. So when we serve governors, we're serving governors across the political spectrum of all states, commonwealths, and territories. And in this context, governors really take a fairly expansive approach to disparities in equity. So as I mentioned earlier, this includes place, so rural versus urban versus exurbs, et cetera, race and ethnicity, disability, felony status, family status, gender, and so on. So given this, there are really a variety of approaches in multiple program areas to address disparities in access. Governors recognize that there is a better need to understand who's being served, who is not being served, and how effective those programs actually are or are not. So two things I would say that we're really hearing in a thematic level is that there's a need for better data collection and analysis to understand the service populations and where those disparities actually exist. And also I would say we're hearing 55, since there are 55 governors, we're hearing 55 unique ways that issues of equity and disparity are surfacing in state policy and practice. And so I think that states are really increasingly interested in a ground-up approach, so really focusing on the community level. What are communities and families really facing? And so in the context of some of our work around two-generation strategies or whole family approaches to addressing poverty, we've been partnering with the Center for Law and Social Policy with the support of the Annie Casey Foundation and W.K. Kellogg and other foundations to really look at what it takes to apply a two-generation lens to state policy and programs. And I think in the context of that work, there's been quite a bit of focus on local innovation, so that several of the states are really finding resources to seed pilot programs. And from there, hoping to generate lessons that could apply to state policy and practice changes. I think there's also an emerging interest, very importantly, in the lived experiences of families and children. And so what that looks like is more authentic engagement of families in public policy decision making. So not just having a panel where you have families listening, but really talking about what their experiences are, what the challenges are that they face, and how having states really think about how families could be co-designers in systems change in state policy.
And Claire, when it comes to building a research agenda that aims toward
Bridging some of these disparities, what is RWJF's goal?
Yeah, I mean, broadly speaking, our goal is that all children and their families, regardless of who they are or where they live, have the opportunity to experience the best physical, social, and emotional development. And so as part of that, we're working to expand opportunities for families to access support that foster children's well-being at the earliest ages. So programs and policies that provide access to early childhood education and care, nutrition, and income are some of the supports that we're focusing on. And one of the ways that we're doing this specifically, if you take a look at the briefs, you'll see, is that we're working to build the evidence base to understand the root causes that contribute to disparities and identify solutions to close those gaps.
So moving on to the second part, which is sort of some of the innovative interventions that you guys have been seeing. Alex, I was wondering what governors care about most. What's sort of top of mind for them when it comes to addressing some of these program and income disparities?
So I would say that there are, as I mentioned, there are a lot of areas where there are disparities, there's access issues, but I think some of the work that we've done most recently at NGA with governors and states, reflecting on the research briefs and the issues of focus, so nutrition access. We did quite a bit of work with governors and their first spouses actually around increasing access to school meals. Given that I think one of the research briefs focused on the disparity in particular among low-income children, children of color, in nutrition. There wasn't as much focus necessarily on the school meals, but I think that's been a huge area of focus and emphasis for governors in recent years. And so we've worked with them around developing universal breakfast, around expanding access to after-school and summer meals. And I think that comes from a recognition of the brain science and also the specific interests that governors have in increasing school performance, the long-term outcomes associated with that, really concerned about brain development overall in early childhood. I think also reflecting on the topics that were in the issue briefs, and I think Michael also mentioned this, states really are looking at expanding access to income support models. And so, for example, I think more than half of all states, 29 to be exact, I think have state earned income tax credits. and the vast majority of those are actually refundable. So they're looked at as a really key strategy to increase income in states. And I think with regard to issues like programs like TANF and recognition of some of the disparities, racial and ethnic and otherwise, in program delivery, there's been a lot of emphasis on focusing on workforce training. So the experiences that families and children have when they're coming to service centers to get access to programs, the implicit bias that sometimes comes across, I think, in casework, and really shifting to a family coaching model where you're working with the family, uncovering their assets, and coaching them to setting goals as opposed to other less best practices oriented ways of working with families. And so you see more of an emphasis on partnering with families and goal setting. And I think aside from income supports, when I talked about disability, there's been several gubernatorial initiatives across the country around increasing access to employment for people with disabilities in particular, really looking at people with disabilities and communities as untapped assets when it comes to developing your workforce. So I think all of those things combined sort of get toward a place where we're looking at a vast variety of strategies to address some of the disparities that we see.
I'm curious, what are some of the less good practices when it comes, as opposed to coaching families? What should people not be doing?
Put me on the spot. I think research has shown that it's less effective in terms of getting TANF clients to look for work and sustain work, models that are, how do you put this? Ones that don't necessarily engage in the goal setting aspect, so more focused on compliance, right? And more focused on what you should not be doing, et cetera, as opposed to what are the aspects or what are the goals that you have in life in terms of career? Where do you want your family to be? Really looking at those positive, asset-focused models, I think, are more what states should be doing and which the research supports.
And Diane, what have you been seeing at the state level? What interventions have you been looking at that seem promising?
Well, there really are a lot of innovations that are happening at the state and also the local level. We've looked, for example, in early childhood education, there are a number of states and districts that are scaling up pre-K. And some of them are really using designs that address equity while they're scaling up. For example, this could mean offering universal pre-K in full or half-day programs, but locating the full-day programs in low-income neighborhoods. It might mean prioritizing low-income communities for earlier startup and rolling out other communities and later expansions. It might also mean targeting pre-K for low-income districts, but then allowing all children in those districts to attend, making it more universal.
Early childhood, I would say the biggest opportunity really is in childcare. So in the 2018 spending bill that Congress passed in March, there was the largest single year increase in federal funding for the Child Care Block Grant. That's the main source of funding for child care assistance for low-income working families. And that funding was just recently maintained. So that's a huge opportunity. And what we're seeing is that states are taking actions that they have not taken in many, many years. So thousands of children coming off a waiting list in Arkansas, thousands of children in Mississippi gaining access to the program, rate increases so that providers have more resources to serve children happening in many, many states. So I think that's the really big opportunity. Now, I would say that within that frame, just providing more access doesn't necessarily reduce the disparities in who's getting help, right? So I think there's lots that states can do to think about as they are expanding access, as they're looking at their policies, reforming some of those policies, how they're reaching underserved populations. And I do think, I'll just maybe pause on that for a moment to say that I do think that one piece of the research agenda, but also maybe a role for philanthropy, is really thinking about that capacity building at the state level. I think, Alex and I have worked with state agencies. The ability to really look at data on disparities and to use it for decision making and think about what it means and how you can change policies as a result. I think that's something where a lot of states are hungry to do more of that and don't always have that kind of capacity or even time built into somebody's job to be able to do that kind of analysis. So I think that's a real area for focus, to think about what it is that state agencies would need to make it more possible to do that kind of analysis. But in terms of childcare, so I do think that looking at who's getting access, thinking about where there are underserved communities, making sure that they are getting new access to the program, looking at childcare settings, at childcare providers in low-income communities, in communities that may not have the resources to meet some of the higher quality standards that we're putting in place, to make sure that we're not leaving them out. And then I guess the piece that I would add in my role as an advocate, I think there's a ton that we can learn from the fact that there is this big influx of funding and states are making changes and taking steps that they haven't before. And while there's lots of innovation happening at the local level, and I think lots of examples that we can really learn from and how programs are working with communities and how states are thinking about directing resources, at the end of the day, there's no substitute for money. And so I do think that as much as we want to look at these ideas for scaling up and think about innovation for a time when there may be more opportunity to grow some of these, there's just no way to scale up without resources. So to me, part of that agenda is, what are we learning that we can then use in a time when there really is a major federal investment, which is what's needed in our early childhood to really, I think, move the needle on the disparities.
Question for Claire and Mike, what can foundations be doing differently or better to support some of these innovations?
I'd say two things. One is policy advocacy, and the other is disaggregate data. When I joined the Casey Foundation 25 years ago, Kids Count was already 5 years old, and basically the theory of change was, if you put out good data about child well-being, 14, 16 indicators, people will do it, people will use it, and they will take that and make good decisions about preventing teen pregnancy, a low birth weight, and in Minnesota and New Hampshire, they did that. They right away say, oh, this is helpful, let's go back and let's change things, and policy will change. Not so much in Alabama or Mississippi or New Mexico. And what we realized over time was just putting out good data, doing a good 50-page research paper doesn't change things, very seldom, only in very select circumstances where the political conditions are right. So over time, we've shifted our resources from research and evaluation, and where we could grow, we put more and more resources into advocacy, particularly grassroots advocacy now. And because we're trying to change the power equation, we're not just trying to put out data, we're trying to change how politics is done within IRS rules, of course. The other thing is disaggregate data. When we put out the first data, we put it out there, and we never thought about race or anything like that. It was, and we missed a whole lot. So over time, we pushed our Kids Count groups to say, okay, you have to disaggregate, and you have to explicitly address race and other important disparities. And some of them got it right away. Some of them said, well, not in our state. We don't want to discuss race, because if you discuss race here, it's a problem. And he said, no, we're going to discuss race, and we'll find out ways to do it smart, but we are going to have that discussion, and we do want to see disaggregated data by all sorts of ways. And as technology improved and capacity improved, the state capacity, every state's now doing it. Some are better than others. And like some areas where we never thought we'd see disaggregated data, we now have it. So for example, the EITC, we could never do that, because when you file your income tax, you don't put down your race. Well, it turns out that folks like Mathematica and Urban Institute and the Center on Budget figured out how to impute it. I hate the word impute, it makes me nervous, but they do. Combining it with census data and things like that. And we are now showing routinely what the impact would be in reducing disparities by increasing a state EITC or the federal EITC. And you can just go down the list. We're getting better and better at it. So I think continued funding and growing policy advocacy and getting more sophisticated about data like Raj Chetty, those are the things that are really going to change.
That's great. And I'm just going to add on to that, because I agree with that, but I also have a couple different things to say, which is, one of the things that we've really struggled with and come to a resolution on is, well, what what is the difference between disparities and health equity and equality? Like, what exactly is health equality? And so RWJF, together with Paula Braveman and a number of other folks, worked together and released a report last year that's on our website that really focuses on what exactly is health equity? What do we mean? And what are all of the definitions of the pieces of health equity? And our definition really is, at the heart, is that everyone should have a fair and just opportunity to be healthy. So at the finest point, that's what we're talking about when we say health equity. It's a positive framing, and it shows you where we're trying to go. And I'd really encourage you all to take a look at that report and get a better sense of what exactly health equity is. So that's one thing that we need to do, is know what we're talking about. It's not just disparities. It's not just identifying gaps. It's getting everybody to a place of opportunity to be healthy, which is not where we're at right now in this country. And I would also say that advocates are incredibly important, and we have a lot of partnerships at RWJF with advocates across the country. The advocates sometimes come to us and say, we need evidence. So you can't just do advocacy. That advocacy has to be based on rigorous evidence that determines whether these innovations actually achieve what they purport to achieve. And the only way that you can say that with confidence is to rigorously evaluate them. I also want to just say that RWJF has a number of ongoing research programs that are meant to evaluate innovations in a host of different areas around health and healthcare. And one of them, you can find them on our website, one of them is called Evidence for Action. And that's actually a rolling program. So we're open today, and we're open every day of the year. And we just ask for a 2-page letter of intent. So if folks want to go online and check out Evidence for Action, Policies for Action, Systems for Action, you can get a sense of the kinds of work that we're funding right now.
Okay, now we're going to shift to talk a little bit about that evidence and how we actually create an evidence base that is focused on equity. I'm going to start with Diane. Diane, can you tell us a little bit about your recent review of an equity-focused research agenda to improve child and family well-being?
Sure. So before I start telling you about the research agenda, I just want to take a second to recognize my colleagues on this project, Jess Harding, Brittany English, and Andrew Berwick, who shared in doing the work with me. So we have been working with Robert Wood Johnson over the past year to really take stock of what we already know about disparities in access and participation in these 3 areas: early childhood education, nutrition programs, and income supports, and then create a research agenda to start filling in the gaps, filling in the knowledge gaps, and also examining promising innovations that have the potential to really make access more equitable. And in developing these research questions, we've really tried to focus on actionable research that can be taken up and used within a relatively short period of time. So we're not trying to do a 10-year longitudinal study, right? We're trying to get some information in a relatively short period of time that is rigorous and that can be used by others. And as has been said, we released a brief series today. There are 4 briefs that talk a lot more depth about our research agenda. I'm just going to give you a few highlights. So as a first step, it's really important to understand more about the disparities. So who is affected? What is the magnitude of the problem? And what are the drivers of those disparities? For example, what are the participation rates in all the different types of early care and education for different subgroups of children? So yes, by race and ethnicity, but also by income and by geography, so rural and urban differences. And what is really driving the disparities in access? Is it information? It's supply, it's lack of funding, but is it also transportation, parental work schedules? And how do these drivers differ by state and by different types of programs? We're also very interested in, as Hannah suggested, examining how state subsidy policies influence access to early care and education for different subgroups. We also have some questions about TANF. For example, how have differences in state TANF policies related to work requirements, exemptions, and sanctions affected access and participation for key subgroups? And what role does caseworker discretion play in that? In the nutrition area, What are the reasons for non-participation in WIC among eligible women, and also why are benefits only partially redeemed among some families? So that gives you a flavor of the kinds of questions we've identified to help us understand disparities. Now I'm going to give you a few examples of questions that are really aimed at learning about strategies with the potential to increase equity and access. So first, what state and local policies can increase the supply of early care and education in areas that don't have a lot of childcare? Sometimes we call those childcare deserts. What policies can improve access for families that need care during non-standard work hours? Because we know they're unfortunately left out. How can state-level coordination of the diverse funding streams increase equity? Might changes in subsidy reimbursement rates for providers affect supply and disparities in access? In terms of income supports, we know that there are many states that already have state EITCs that are kind of designed to boost the access to the federal EITC. So if you can get a state EITC, you might be more likely to apply for both. So what lessons can we learn from the states that have already done that? And what would it cost for other states to do it? In the area of nutrition supports, what strategies would promote WIC enrollment and retention, and which strategies work best for different subgroups of eligible women and children? And similarly, what strategies could be used to increase full redemption of WIC benefits? Now, another way to think about these questions is to really look across programs instead of looking within each program. So we also have a set of cross-cutting questions, and I think these are some of the most interesting and might be among the most helpful. So first, what are the characteristics of low-income families that don't receive supports, right? For example, there may be families who don't receive TANF, they don't receive childcare subsidies, perhaps they've reached their lifetime limit for TANF, but they're also not eligible for EITC, and they're not eligible for the Child Independent Care Tax Credit. Who are those families and what's happening to them? Next, what are the characteristics of communities with limited access to supports? So do childcare deserts overlap with food deserts? And what role does caseworker discretion play? The role of caseworker discretion in TANF, how does that affect access to childcare subsidies? You can begin to see that there is kind of a cascading effect. If you get shut out of one program, you might get shut out of another program. Another example is related to early care and education. So to be eligible for the Child and Adult Care Food Program, which provides nutrition supports in child care, there are certain requirements, and some home-based child care providers may not meet them, and we know that low-income families are disproportionately using that type of care. So in a final question, how can early childhood education, income supports, and nutrition programs really reinforce each other to meet the needs of families? Are there ways to coordinate across these programs to create a more effective and more efficient use of the services on behalf of families? So just a quick overview.
Yeah, so rather than focus on barriers, I'm going to focus on opportunities. And actually, I'm going to echo just a little bit of what Alex said is happening at the NGA. But first, I'll just say that we really need researchers from all backgrounds to be doing this work. We need diverse people, organizations, and partnerships to be asking and answering the questions about the policies and programs we've discussed today. And as Alex mentioned, the NGA is starting to focus on what I'll talk about next, which is we really need people who are participants in this program to help develop hypotheses with us and insights with us, so that people on the ground are really helping us to create the best and most useful evidence. I think what Mathematica has done is really fabulous and does get very close to what's really happening on the ground, but we can do even better if we can involve people who are actually participating in this as their lived experience. So it sounds like we're all going in that direction.
Great. Well, question to the rest of you, what are kind of the most important next steps from your perspective in building this research agenda?
Yeah, so rather than focus on barriers, I'm going to focus on opportunities. And actually, I'm going to echo just a little bit of what Alex said is happening at the NGA. But first, I'll just say that we really need people who are participants in this program to help develop hypotheses with us and insights with us, so that people on the ground are really helping us to create the best and most useful evidence. I think what Mathematica has done is really fabulous and does get very close to what's really happening on the ground, but we can do even better if we can involve people who are actually participating in this as their lived experience. So it sounds like we're all going in that direction.
Well, question to the rest of you, what are kind of the most important next steps from your perspective in building this research agenda?
start. So, I mean, I guess I would first say that I think not only in terms of a research agenda, but really when we're talking about young children, I mean, I would just reiterate the diversity that exists there. Young children are, that might be my mic, majority, minority. We know that we actually can't move the field forward when we're talking about any of these programs if we're not looking at disparities. So I think that's just like a first given that we have to be looking there. And then I guess to go back to my earlier point, in my opinion, innovation itself can't save the day, but a major federal investment can. And so when that day comes, we have to make sure that the programs that we're creating and the policies work for children of color, period. I wanted to just add on a little bit to what Diane talked about, which I think that a really critical next step is really looking more closely at the circumstance of parents, and in particular, parents working in low-wage jobs. It's over a quarter of parents with young children that are working outside of traditional hours. We know that the volatile schedules, the just-in-time scheduling is becoming more the matter of course and the norm for low-wage jobs. And I think we haven't fully crafted a research agenda that figures out how to put together those pieces and the realities of how challenging it is to actually be working and also care for your children and for your family. So figuring out how we think about those low-wage jobs and the relationship to early care and education is really, really critical. And that means both looking at the informal childcare sector, looking at what families' needs are, but also thinking more about what it actually means to create a supply of childcare that families can use, as well as changing those conditions of work as well, of course. And then I think I would just reiterate the idea of how important it is to really start unpacking not just the barriers, but looking for solutions. It's going to take really intensive work in states, and I think we talked a little bit about how much of a desire there is to really be hearing from people in communities and from those who have really had experiences with these programs and services. But I think really bringing it together in a meaningful way to start influencing policy is just a critical next step.
I'll go next. In shaping and determining a research agenda in this area, I think one of the big challenges, and I think we're all getting better at it, is picking topics and issues in research that are policy relevant. The timing is so important, and having the research available to help inform real-life policy debates is what it's all about. And I do think we're getting better, but that's something we just really need to focus on. A good example is a project that RWJF and Casey and half a dozen other funders are supporting is something called Baby's First Year. And the idea there is, what effect would just increasing the income of a very low-income family with a newborn, mom and a newborn baby, have on the development of that child? Unconditional cash transfer. If you make her less poor and her child less poor, will that have an effect on the development of the baby between birth and age 3 or 4? And so what they're going to do is, RCT, they're going to take moms with newborn infants in 4 sites around the country, and the control group will get a debit card, and every month they'll get $20. The treatment group will get a debit card with $333 on it every month, unconditional. It's on top of whatever they earn, on whatever they get from TANF. There won't be any clawback from SNAP or any of the other programs. They've worked it out with the states. And so those moms will be $4,000 less poor each year. And they don't have to, we'll know how they're spending because it's a debit card and they'll be tracking things. But we want to see what effect that has on the development of that very young child, particularly brain development. Because research suggests that that difference, $4,000, is enough to have a demonstrable impact on the development of a child's brain. So they'll work with these moms, they'll bring them in and they'll visit the homes, and then at age 3 they'll do a brain scan, treatment control group, and they'll be able to tell an awful lot. There are 2 hypotheses. One is how this $4,000 might affect the mom and the baby. The first is simply by having $4,000 more a year, she'll be able to use it for resources that help the kid. Better food, maybe a better apartment, maybe a car so she can get a job, more books, a better daycare program, whatever, and we'll know how she's spending it. And the second hypothesis, which I'm more interested in really, because it's more, well, I think it's just more interesting, is that by reducing maternal stress and depression, that will have a direct effect on the child's development. And if you just help her not live in such miserable circumstances, make her a little bit less poor, she's going to be less stressed and less depressed, and that will affect the child development. And so, this is, I think, a project that will have some real policy implications. Think about it. Last year we had a big tax debate, and they had a child tax credit that was significantly increased for rich people, working class people, but not for low income people, because it was all possible. But I think that if we had research showing that extending that tax credit down to the lowest income level has a manifest impact upon the development of a baby's brain, I think that's very powerful politically. We saw that with Ypsilanti, Hickman's research. Once you start saying that it affects the development of a person's brain, you cut through a lot of ideology, and a lot of it's their fault, no, it's your fault, it's the system's fault, and you're able to focus on what's important. Similarly, right now, there's a lot of interest in universal basic income or child allowances, and there's a lot of people saying we need it because the jobs are disappearing and all this stuff. Well, again, I think if we had good information on how a universal child allowance would affect the development of a very young child, I think that could be very impactful. We can't do it with the EITC because that would entail taking away a benefit, but you could just supplement on top of everything else a $4,000 income increase. And the research you're doing are top-tier brain scientists and child development specialists, Greg Duncan, Kim Noble, and I think by my job with them has been staying in touch with the advocacy community and the Washington policy scene and figuring out where they'll have levers over the next 3 or 4 years because they just had random assignments start in April. And help them roll this out in a way that will change the debate. So that would be an example of how I think where we should go with research.
I think we've gotten a number of really great, really solid suggestions. I would just add very briefly that we're at a key time in terms of making sure this information is actionable, one, and that it's translated and gets to decision makers fairly quickly, because we have, as we talked about already, 39 gubernatorial elections. We have legislative elections in 46 states, and we'll have a tremendous amount of transition in state government and at the legislature. And so I think the field needs to be armed with the information on what works and what doesn't work. And I want to reemphasize something that Hannah said too about making sure that states have the capacity to actually do something with all this information and data when it comes to policy decision making.
Diane, do you have any reactions or anything else you want to add to
I think
what's
those
been
are all
said?
fabulous ideas, and I agree about getting it out there and providing assistance to help states make good decisions with the information.
Okay, well, I think we're going to open it up to questions now, and we have webinar people, if you can hear me. You can also submit your questions, and I'll be alternating back and forth. So first, let's go to the room. Is there anyone in the room who has a question for the panel? Right there. And we have a mic runner, so he's going to come over, and that way the webinar people can help you or can hear you.
Hello, thanks so much. This is so interesting. I'm Carrie Gillespie. I'm from the Education Trust. I was just wondering, I recently saw a study, I think from Child Trends, that showed that 97% of young children are in home-based care, and of those, only a quarter or so are paid providers, and of those, only about 10% were registered paid providers. So that really made me think that we don't know a lot about a lot of children. So it's great to focus on the state-funded and publicly funded programs, but for the 97%, and I think that has a lot to do with what you've already touched on about the lack of data out there. And I was wondering if you've heard anything about how to get a better picture of what's happening there, because I can think of many challenges to figuring that out.
I think the best information we have is from the National Survey of Early Care and Education. I think that's probably the best estimate. And I believe there are about 7 million children in home-based childcare. I think home-based childcare is the most prevalent form of childcare for infants and toddlers, and also very common for low-income children in general. I think a small proportion of that is licensed, family childcare licensed or registered, depending on the state, but the vast, vast majority of it is what we would call exempt care, or it's often a relative or a family friend and neighbor care is often what it's called. And yes, those children would be sort of outside the state system. In some states, families may be able to get a small subsidy. The subsidy rates tend to be very low, and the new regulations, Hannah might be able to say more about this, have made that more difficult, quite a bit more difficult. So you're talking about largely low-income folks taking care of low-income children without very much support. They don't have access to the quality rating and improvement systems in states that provide support for improving quality in child care settings because they're not regulated. They also don't have access to the Child and Adult Care Food Program, which would provide nutrition support. So they're really being shut out of quite a few things by virtue of being in that type of care. And I think, the problem is in many communities, there just isn't enough supply and there isn't enough funding, as Hannah has said.
Well, and I would add supply, it's funding, but it's also then the realities of both the care that families want and the care that families can use, right? So when your work schedule changes with a week's notice, it's simply not possible to use even a licensed home-based providers, right? Even licensed family child care providers can't, they have to maintain ratios, they have to have a certain number of kids, so they can't just change who they're caring for on a regular basis. So, I think this just, your point is really exemplifies just how much we need to think about building out both the quality early childhood program, the ones that we talk about that are having real results for kids, building the quality, but also making sure that we're not essentially, in many cases, worsening disparities where there's a set of kids that are untouched by any of these programs and whose families are facing real challenges in terms of access. So I think it's another area to really take a hard look at within early childhood.
And I think one way to address the equity issue there is to think about how can we provide supports to those family, friend, and neighbor providers. What can we do to help them improve the quality of care that they're providing? Because, when you think about the numbers that we're talking about, it's hard to imagine that you could create that many facilities in a very short period of time. And, these children are developing rapidly and they need support now.
But there's lots of ways to think about infant toddler care and how we get supports to caregivers. It's about supporting children's first caregivers. It's about paid family medical leave so that parents can stay home with their infants longer, right? But it's also about thinking about what the models are. There have been places that have done home visiting models, for example, with family, friend, and neighbor caregivers to really bring supports to those providers. So I think we have to think much more kind of broadly both about access to programs, but more so, and this goes to your research brief that really looks across at income security and nutrition and early childhood education, what are we doing for parents with very young children? And that's going to come from a range of different programs and services and supports.
Yes, we have several fantastic questions from the webinar audience. The first one, which is not directed to anyone in particular, from Luisa Tarullo from Mathematica. Can you speak about availability of subsidies for care and non-standard hours in order to support families who have flexible or unpredictable work schedules?
So depending on the state, all of these policy choices within subsidy are state policy choices. In some states, there are differences in who can be a provider and actually receive subsidies. So there are some states that limit access to subsidies to either just licensed providers or even to licensed providers that meet a certain set of higher quality standards, which also raises questions about whether those providers are located in low-income communities and communities of color, whether those providers have access to moving up those quality rating systems that you mentioned. So in some cases, states put limits on those providers. In other cases, it may have more to do with how a state determines eligibility and what's required for a parent to be able to maintain that access. So in the example of, let's say, a parent who has a varying schedule, if in fact your care is tied very tightly to the hours that you work, then it's very hard to use a subsidy, right? So many states, and some of the work that was done through the reauthorization in 2014 of the Childcare program was really with the idea of creating a little bit looser connection between parents' work and children's care, recognizing that a child needs a stable setting on a daily basis, even if those hours shift for the parent. And so making sure that parents who do have need for non-traditional hour care, who have varying schedules, have more access to subsidies. I think in reality, we're a little ways out from actually having policies in place that do that for families. So I think that, again, that's a place that states can be thinking about their policies and really looking at the realities of work that parents have.
Back there, back of the room.
My name's, Hi, I'm Kirsten Stewart. I'm at Futures Without Violence, and I actually have two questions. So the first is knowing the data around the impacts of domestic violence and maternal trauma histories, both how they relate to depression, but then also just in terms of the ability for babies to attach and early caregiving. Is the Baby's First Year study gathering that data in terms of moms' experiences with domestic violence or parental trauma? So that's question one. And then question two is with the Family First bill, which is around reducing child abuse and trying to keep kids out of the foster care system. There is now a new potential entitlement to do more preventative services that are supportive of family. And I'm wondering if there's any states that are looking at that as an opportunity to do more of this child care, early care. I know it's tricky. What's qualifies as preventing entry into foster care, but I know some states are trying to be creative. Thanks.
In regards, domestic violence will be addressed as part of the mental health assessment and the stress assessment. So that will be, now I don't know how much they're going to be doing with it. I'm not involved in designing the research design, but there will be home visitations and interviews with the mom for both, her assessment of the child's development and in her own circumstances, and in trying to tease out which of those two hypotheses might be right. That will be part of it, I know. But I don't know the details. I can connect you afterwards to the people who are doing the research. And on Family First, I just don't know that. My colleague, Rob Geen, knows that better than I.
And I think with Family First, states are very much in their early planning stages of determining whether or not they're going to opt into the prevention side of that law. And there's also a requirement that states really adopt evidence-informed strategies on various levels. And they're determining what those programs, what that array of programs will look like. But I think it's an interesting question to think about whether or not childcare, if there are some promising practices that are tied to a reduction in maltreatment or child abuse and neglect, then uplifting that for states to consider when they're thinking about the variety of programs they might offer. If they opt into the prevention side of Family First, that I think would be a really key idea.
Yes, this question comes from Ashley Wilson, and this is directed to Claire. You mentioned the report by RWJF about health equity and knowing what we're talking about when distinguishing between equity, disparity, etc. Can you talk about how important it is to have consistent definitions when thinking about equity in policy research?
That's a great question, and I would say that if you're not using, this can happen, it's not just equity, inequality, and disparities. Really anything that we talk about, we need to have a shared understanding of what we're talking about. We need to have a pretty good level of specificity. Otherwise, you certainly can't do research on something if you're fuzzy. Research requires specificity and specific definitions. And I think also just more broadly, maybe 10, 20 years ago, we were largely focusing on disparities, and our research really focused on the fact that disparities existed and just trying to make that argument that some people are here and some people are here, and that's not good, and it's not right. And we've tried to move away from simply documenting disparities to focusing on solutions. And now we're focusing on solutions, and we're trying to move the conversation even further to a more positive framing around opportunity, that everybody should have an opportunity to have an equal and healthy life, rather than just to that very negative and not always very helpful place of there's differences. Differences are important to recognize, especially when it comes to access to programs. That's pretty clear that we need to address those. More broadly, we need to focus on equity and making everyone have that shared opportunity. So yeah, I think I'll leave it at that. That's a great question.
Is there another webinar question?
There is. So this question comes from Alikia Prathviadi. American Indian and Alaskan Native people are often underrepresented in data and general public discourse. Children in these communities face severe health and educational disparities, but are often ignored or overlooked. Can someone or anyone on the panel please address this issue?
The American Community Survey has been a big help to us at the Casey Foundation, because now by aggregating years you can get more information on subpopulations. So in many cases, not all, we're actually able to disaggregate, for smaller populations. And for example, it's important to understand the differential impacts among different Hispanic populations. You lump them all together, you get a very muddied picture when in fact there's big differences in Asian. So using the new databases, and Raj Chetty's is going to be really interesting here, you can find things where in the past we just didn't have the technology. So I think that's very exciting, and I think her concern and issue will be at least partially addressed more and more in the future as we disaggregate better and use bigger data sets.
I'm just gonna sort of second that and say that we have funded some work around disaggregation, and I'm not the program officer for that. That's Tina Coe, but that is something that we strongly support as well, and it's incredibly important, not just to demonstrate where specific populations of people are at, but also to help design interventions, because people in different situations need different types of interventions to support the well-being and health of children and their families. So it's incredibly important, and I'm glad that that question was sent in. Diane?
I was going to give the example of our home visiting evidence of effectiveness review. So this is a systematic evidence review of early childhood home visiting programs. And if you go, it's the Home V website. If you go on that website, there is a whole series of publications about programs for American Indian Alaskan Natives. And we have been doing a separate review of those programs every year since the Home V project started. And there's a very small amount of research. There are a few interventions that were developed for Native American communities. And there's information about how the programs are implemented. But I think this really speaks to some of the comments that were made earlier about needing to have more diverse investigators, and to really think about how to do research with specific populations in a more culturally relevant way. And not just assuming if we have an evidence-based intervention, when you look at those, often they haven't ever been tested with, say, a Native American population, and so they may not really be appropriate, and there may be some adaptation required. So I just think we need to pay more attention to that in doing this research, and I think it requires more diverse investigators.
Hi, my name is Claire Smither-Wilson, and I'm an analyst here at Mathematica. And my question is, could you all talk a little bit about how you balance kind of the value and cultural basis behind childcare decisions? So thinking about, some families prefer one-on-one care and in-home care versus daycare, and how you can balance measuring equity and providing subsidy by also maintaining quality.
I think, one of the reasons we've been talking about home-based childcare, and one of the reasons families use home-based childcare is because they want
certain cultural values to be instilled in their children. They want their children to eat certain types of foods. There are all kinds of reasons why they might want their especially very young children to be cared for in a home setting which is much like their home setting. There may be language considerations and all kinds of things like that. So I think parent preferences are really important, and the issue is we need to make sure that the resources to support quality are going into the whole range of settings that parents want and need, right? Not just in center-based settings, but in all of these settings, so that families that want certain type of care for cultural reasons also have access to high-quality care.
Do we know very much about those parents who are choosing that because of their preference, and parents who are choosing that because of income considerations?
I think there are qualitative studies, there are small selected samples. I'm not sure if we have any good national data. Do you know, Hannah?
I mean, because the reality is, of course families have preferences, and we could then, back to the idea of lumping, it's not just by income and it's not just by race and ethnicity. Every family has their own preferences related to the care of their individual children, right? And so I think we have a little bit of that, but I also think then when we start to look at where families are and the care that they're choosing, even by using the word choose, I think we are not representing what's often happening, right? Because we've talked about the shortage of supply. We've talked about the lack of affordable options regardless of where that care is. So I think that there is clearly parent preferences play into all of this, but for the vast majority of families, they are not choosing. They are selecting their childcare options by the default options that remain available, right? So so again, to say it's messy, I think it is, right? And I think there's lots of reasons why it's really hard to get an assessment from parents about what their real preferences would be, particularly if they've never had an option for any other settings.
Yes. This question comes from Joanne Lee, directed to the full panel. How would you recommend states or policymakers balance the goals of pursuing and researching new programs or services versus improving the fidelity of existing programs with low participation or funding?
I'll start. It's an interesting question. I think it's important. There needs to be some flexibility, right? So it's important to make sure that you are implementing and exploring programs that have some evidence of what works, and that you're testing them for your specific populations, and that there's resources to support, whether it's through a connection with a university, a local university, or a partnership, or through other external evaluators, making sure that what you're doing is actually working for your population. I think that through partnerships with universities, increasingly we see that more and more in our state work. There is more of an appetite and an ability to really think about fidelity and to make sure that, as you're implementing, you are trying to stick within that model and implementing in a way that actually would align with what the research has been showing. But the balance question is an interesting one. And we all know also that evidence-based programs are often more expensive, and that there are other programs that have shown promising evidence but don't necessarily have the resources to be evaluated through an RCT, et cetera. So I think that it is very important to strike a balance between moving forward and providing a space for experimentation, while also partnering with universities and other experts to make sure that you're implementing models or programs with fidelity.
I think what we've been focusing on is really looking at major programs to support families that are, in theory, available, and looking at how to make them work better, how to help families access them. For example, the WIC program, we know that a little more than half of eligible women and children are using WIC, and then many times families get a monthly benefit and they don't redeem the full benefit. And we need to understand more about why that is. What is it about the program that's making it difficult for them? Is it that they don't have access to the foods? Is it something about the voucher? And really make that better. So I think that's partly where the balance comes in too. There are these existing programs, but they need some adaptation and some enhancement to really make them work for families, right? Getting back to this issue of the family's lived experience.
Yeah.
From personal experience, when I worked in the state government of New Jersey back in the 70s and 80s and 90s, we were pretty aggressive in trying to participate in federal demonstrations, foundation-funded demonstrations and research evaluations, partly because it helped us to get exposed to some of the smartest people in the country. So not only did we learn a lot, I think by exposure, we understood we were at the cutting edge of a lot of things that we wouldn't if we had said, oh, we're not going to try to take this opportunity. It's diversionary. We've got to keep doing this over here and really focus on that. So I would advise states, if they can, to try to take advantage of those opportunities where they can. Be aggressive in pursuing foundation support and waiver support. HHS, at least many years, puts millions of dollars into this. So I think there are opportunities as well as costs for them doing it. The other thing I would say is, I'm no expert, but I do know that the cost of evaluation has dropped so dramatically because of the new technologies. It used to be that if you're going to do a random assignment evaluation, you'd have to have 8 figures, and now it's like, well, we'll just do it on an app. And it's like, there's an app for that? Really? And it turns out that there is. So, I would say, explore it and put the time and energy in, even if you are sort of overextended and trying to run the agency.
This one is directed at Hannah or anyone on the panel. How can we ensure that the early childhood workforce is representative of the families they serve, especially as that workforce is struggling with issues of recruitment, retention, and compensation, at the same time that efforts are being made to professionalize the workforce?
So, I think it's interesting because there certainly are communities where we actually need to do, I think, a lot more work in terms of making sure that there is a workforce that is reflective of the kids served. But if you look at the early childhood workforce in comparison to, say, the K-12 workforce, it's much more diverse. But that diversity is often very stratified when we look across levels of teaching staff in programs. And we have a low-wage job in early childhood, which is not able to create pathways for many women of color who are the caregivers to actually be able to stay in the field and to continue to grow and to support their families at the same time. And as the person who asked the question pointed out, we then also have this kind of competing demand where there's a lot of focus on professionalization, and I think that there are a lot of people in the field who are concerned that we will lose the diversity that we have in the workforce, that it has to be maintained at the same time. I think that means really taking seriously the issue of compensation. We simply can't expect early childhood to be a field that people want to go into and stay in if they can't support a family on it. And so it's really, I think compensation has to be central to it. That challenge is a big one because there's simply no way of rearranging the resources that we have or just looking at policy changes that can actually support having a well-compensated workforce unless we have a dramatically higher level of investment, both at the federal and the state level, frankly. So I think keeping in mind the importance of keeping that diversity and building on it and thinking about what an asset is, it really has to be about putting compensation first.
Anything from the room? All right, let's go to the webinar.
Okay. This one's for Diane. What are some of the effective uses or models that have grown out of an equity-focused research agenda?
Well, I think actually that's really the focus of our research agenda, to try to find out what's effective. There are a number of innovations. If you look at the briefs, there's lots of really good ideas out there, and states and localities are trying lots of different strategies. I mean, they're out there doing it right now, and so what we want to do is be able to study some of those and learn about implementation, what worked, what didn't work from that standpoint, lessons from them, and also try to figure out if they're effective at creating more equity. I mentioned some of the ones that we featured about scaling up universal pre-K. Some other ideas are, for example, behavioral interventions with a SNAP program. Could you, if you gave like a rebate for purchasing fresh fruits and vegetables, would that increase the intake of nutritious food? Or if you gave the benefits more often, like every week or every other week, would that encourage people to purchase perishable food? If you allowed people to pre-order or prepay, sometimes that's referred to as a pre-commitment, to purchase healthier food. So there's not a shortage of good ideas, but we need to catch up and get out there and study them to figure out which ones really are working.
A question for the full panel. How do you all distinguish between equity and equality?
Diane actually tipped me off that this question was in the queue, so I had a chance to think about it. And you know, at RWJF, we've obviously been doing a lot of thinking about this and work on this for quite a while. And one of the illustrations that's circulated to demonstrate this, I think, is really helpful. And it's a little bit hard to describe verbally, but I'll go ahead and maybe you guys can find this online. But if you can imagine a picture where there are 3 children of different heights, and they're all looking over a fence at a baseball game that's going on. And the equality is giving everyone, and none of them can see over the fence unless they get some sort of support. So all of the equality is giving them exactly the same height box, so maybe 2 feet tall. So all of them are 2 feet higher, but still only 2 of the children can see over the fence, because the shortest one, that would probably be me, the shortest one still can't see over the fence, even though that child has gotten the same equal investment or equal box to step on. And equity is really giving everyone the different levels of support that they need, or different heights of the boxes, so that they can all see over the fence. So equality is not good enough. It's not really what we're helping, because not everyone is starting out at the same place in this country. So equity is what's getting us to everyone really achieving health and well-being in this country.
Very good analogy. Go ahead, yeah.
Yeah, okay.
And in fact, you know, because I knew what we were going to be discussing, I went to our race, equity, inclusion folks and said, you know, let me check all this stuff out, you know, that you taught me over the years, and refresh it. And what you do at RWJ is very similar to what we do. We're very much in sync on this.
So I would just add, because I think, and we've also actually we've done racial equity trainings at CLASP and have used the same visual. But so I guess just to think about it and kind of play it out, right? That's essentially that box metaphor becomes the policy strategies that we're trying to use, right? So it's actually not enough to say, you know, we'll just have universal pre-K and everybody will have access to it, because that doesn't happen, right? We have to then use our policy and use the implementation of policy to think about where are we targeting those resources, where are those pre-K programs available, what is it about how we're designing that universal system that actually means that families can use it even if they, you know, have different work hours. So I think to me it's the policies then that are playing out to actually play that role of really helping to move equity forward.
One other thing that Diana and I were chatting about is that there are also, it's not good enough just to get people started. You have to follow them through. And so the study that's referenced is it the TANF brief?
It's the income support brief.
Income support brief, where people who are doing intake with people who are signing up for supports, they have discretion about who gets referred where, and they're showing racial and ethnic bias, which probably isn't a surprise to many of you, but it means that you have to follow equity through the whole process, that it's incredibly important, because we have such ingrained bias that if you're not really looking for it throughout the experience of an individual person, you're not going to find it. And you're going to say, but we gave this opportunity to everyone, why are we still seeing lack of equity or disparities?
There's a very nice report. I believe it's an OPRE report from 2017, and I'm sorry that I don't know off the top of my head who the author is, but it's looking at racial and ethnic disparities in ACF programs, and it has a very nice conceptual framework that shows that you really need to look at each step in the process to really understand disparities and how to create equity. So it's at the eligibility stage, at the access stage. And there are about 5 different steps that they lay out, and the importance of really examining each one of those to get to equity.
I would just add that I think the illustration that you really described very well, actually, that we've used in some of our trainings with state level or state leaders is incredibly important, because I think when it comes to conversations around equity, folks' minds go particularly to race, which is often a hot topic. And there's all kinds of, depending on where you are in the political spectrum, et cetera, and who the folks are who are in your state, you can really get stuck at the beginning of that conversation. And I think it's important to have very clear definitions, to talk through what it means from your perspective in your state, et cetera, and then think through, as Hannah talked about, how equity plays out in policy. So the illustration is a great starting point, but then what does that mean in terms of service delivery? What does it mean in terms of tracking outcomes? All of those sorts of things that Diane actually just mentioned as well. So, yep.
We have time for a few more questions if there are still questions in the queue.
There sure are. And this one is directed for Hannah. And it's, just want to make sure it's kind of long, but I think I can get it out. So this is from Rachel Farley from Austin Public Health. We want to increase the number of providers participating in our state's voluntary QRIS system. But too many children receiving subsidies here are not with quality rated providers. We are exploring a pilot to require that for providers to accept subsidies, they must be high quality. So how do you recommend that we might increase the availability of quality providers, but not increase disparities?
So I think that it's really important to take the steps to support providers before we put more restrictions in place. Because what we
don't want to do is inadvertently cut families off from using any care. So there are clearly efforts to increase the number of providers who meet certain quality standards across communities and across states, but we know that in fact those providers aren't equally available in all communities and don't necessarily meet the needs of families. So my advice in that circumstance would be, before taking that step of actually limiting who the subsidies can go to, is to using resources to look at the needs of providers in communities, to help with sometimes it's funding for certain quality improvements. Maybe it's looking at the training. What is it that's needed for those providers to meet those ratings, and really have a focus target on improving quality before we're cutting providers off, because I think we hurt both providers. We take the chance of actually reducing even further the supply of care in communities where providers really need those subsidies, particularly when they're in low-income communities where families can't pay more for childcare, and also cutting families off from care they need. So, and my perspective is different than many in the field in that, but I think we have such a need for providers that don't kind of fit exactly into what we are deeming as quality, because families have so many diverse needs that we really have to take a hard look at that.
All for questions in the room. Oh, question right there. Yeah. Oh, the mic is coming. Sorry. Hold on one second.
Hi. So my name is JB Wogan. I'm communications here at Mathematica. So some cities and states are passing fair scheduling laws, trying to introduce more predictable scheduling into the workforce. For legislators or counselors who are interested in passing these laws or who do so, what should they be asking afterwards to see if it's working? Like, what data would they be relying on, or what are the measures that would show that the families are getting access to early childhood education and care, or that it's more equitable than it was before?
Yeah, that's a tough question. So you're saying what data can we use to figure out whether fair scheduling is helping families gain access to early childhood education?
Yeah, because I think that is something that is being cited as an argument for passing these laws in the front end. So I'm wondering, once it's passed, how do they verify that it did what it was intended to do?
That's a tough one. I mean, do you have an idea? Yeah.
Qualitative data is very helpful in this type of thing. You're not going to have big data sets, I don't think, and it's too expensive to do a big survey to find them relatively small. So I'd say, good qualitative insights. I think it's also important to have focus groups with the employers, those who are affected by it, because you want to anticipate, their experiences and, be able to address them and fine-tune things. But that's just one quick suggestion.
You might be able to look at absenteeism or job retention because families have better access to care. It would also be great to do a small-scale trial and actually look to see what happens and work out some of the kinks as well before scaling it up.
I was going to say, I think this is another area where the complication of both families' lives and then the services that exist around them are going to be very challenging in addition, right? So we know that being able to access reliable, steady childcare is one really important reason for having some of these fair scheduling laws. And then the reality is that where you pass that law, what does the childcare system look like, and what care can families access, and what's available, and what can they afford, right? So having a more stable schedule may in fact help you be able to use the same provider on a regular basis, but does it actually, does it increase wages sufficient that you can actually access more affordable, more expensive care? So I think the focus group piece, really being able to kind of hear what's changed in families' lives and what more needs to be done is really important, because I just think having one policy go into effect, there's just so much more that's going on there that impacts how families can interact with these systems.
That's absolutely right. It's extremely complex, and there's interrelationships between all the different systems, and it's a place to come and be discussing that. I will just say that
for our Evidence for Action program, we have studied with an RCT the initial implementation of stable schedules in a few of the GAP stores, and I think they've rolled it out nationally now, but they hadn't rolled it out nationally initially, and we looked at both the impact on the business, the business case, and also on health outcomes, and those findings haven't been published yet. But on the business case side, they're very promising, and on the health outcomes side, they're still working on that. But if you all go to evidencefораction.org, there is an RCT. Now, that's not just among parents; that's among people who worked for the GAP in a couple different states, and I can't remember how many stores. But we are starting to develop some of that evidence, but it will take many studies, and I think focus groups and qualitative data are incredibly important, but also would push for rigorous experimental designs as well.
Well, thank you all for being here. Thank you all for coming. There's a survey that they're going to email out to you that they'd like for you to fill out, and snacks and goodies are outside, so please stick around and eat some of those. Yeah, thank you.
Thank you.
Thanks, everyone.